Welcome to Policy Talks. Today we have with us a very dynamic IAS officer of the Assam Meghalaya cadre, Mr. Sampath Kumar. Welcome, Mr. Kumar, to ISP Studios.
Thank you.
Mr. Sampath Kumar is currently the Principal Secretary and the Developmental Commissioner in the state of Meghalaya. And he has been very, very passionate towards academics, and he went to the Harvard Kennedy School to do a master's program in public administration. So it's a pleasure to have you here, Mr. Kumar, at the ISP Studios for the Public Policy Talks.
Thank you.
There might have been a lot of diversity that you have witnessed, and all of this diversity is a part of what India is all about. So as an administrator, what have been your takeaways that you are now using and maybe utilizing as an experience in formulating policies for the state of Meghalaya?
One of the things that I really see is that there is every state has unique challenges. India is such a diverse country. And every state has a different kind of an organizational culture. So, but there are some broad common elements that you can see is that, yes, there is if you come to erstwhile AP, that means now currently it's Andhra Pradesh plus Telangana. So if you you see a lot of developmental administrators more, you get a different kind of a sense of, like work and, purpose, like when you work in these states. Then when you go to, northeastern India, the challenges, when we joined in 97 were different. It was completely, there was a lot of insurgency and very difficult, to work. But again, we started looking at the problem differently. What is the source of that problem? Why there is such a, lack of trust on the government? How actually we can build the trust on the government. What we did was we experimented, by engaging the traditional institutions, building those developmental institutions in the developmental process. Then they started actually seeing that sense of, participation, sense of ownership has come up. So the entire, the civil unrest kind of a thing had just gone, with the process of development. So that's one thing that we have seen. And from thereafter, I say UP, if you look at it, UP is a more of a, a regulatory state because that was a kind of a huge population. And so what we worked there was like how to mobilize the poor, organize the poor, especially take women, once you organize the women into the women's economic collectives, we call them self-help groups, and
True.
use those platforms to deliver different developmental interventions. So this is it's a great, what the service gives, like when you ask like public administration, it gives an opportunity. First of all, it gives you a credibility. You can go and start working.
True. True.
And you're also at a stage where you work very closely with the political leadership.
True.
So it is much easier for you to really bring policies which are more of a citizen-centric. So I think it's an immense opportunity that I got, and I'm very lucky to actually have worked in all the parts of the country. Thank you.
Great. No, that's an amazing experience. You spoke about women in particular, and I'm going to Meghalaya now. A matrilineal society, but there have been a lot of challenges, especially when we talk about women. The maternal mortality rate has been amongst the highest in the country. So what are the efforts that are being put up in that case, and what are the challenges?
Yeah, yes, matrilineal society has its own strengths. In fact, matrilineal society gives the women a lot of economic rights, economic endowments. But what happened was, in the matrilineal society, the women have taken the role, of the rising children, handling the entire family. So it's like basically they have taken a huge responsibility. It can be considered as a burden sometimes, because huge responsibility. And by the time, like you see a woman with 30-year-old and she already have 6 children. And because of that, what has happened, because of lack of spacing between one birth to another, I call lack of birth spacing, the women naturally become anemic, and
Right.
And they're not ready for so in the process of delivering another baby, they're more more prone to more danger. So that's the reason maternal deaths were occurring a lot. So to address this problem, what we started doing is that how to engage women in a public affairs. So we started addressing the systemic problem, like how to bring the more women's participation, so that they can actually start looking at these things in a much more perspective. They can also take care of their women's health, the self-care, how important it is to really give that kind of an undivided attention for the mother during the pregnancy and post-pregnancy. So all those measures helped us to reduce maternal deaths recently. Over 40% reduction that has been witnessed during the last 2 years.
Coming to your other initiatives, I read about your government innovation lab that you are starting.
Yeah.
And I think a lot of experiments that you are doing with capability enhancement in particular.
Yeah.
So how are you trying to address those issues, and how are you taking forward this initiative?
So by mobilizing the people and giving them the problem, instead of actually telling them that you do this work, this is the way you focus on institution deliveries, we started asking them, how can you save the mothers? Then they started coming up with the solution. See, we are not able to save these mothers because they are living very far away. In fact, Meghalaya has the most remotest places in the country. So basically, when we have given this autonomy, this is where the autonomy is given to the people who are closer to the problem. And they are able to find solutions. They are able to solve the problem. So they also get motivation of that, we are solving the problem. So in the process, what we have been doing is that we are providing a kind of a holding environment, so that even if you, have, basically make some, something, an error, there is something to really, for you to, okay, it's okay. But but you start taking some action, start solving the problem.
After having, talked about so many initiatives, I think if you could just refer, and this is the last question, there are many other things that Meghalaya is doing, and some of that we as ISP we've been involved with. Can you just reflect on that a bit?
So this is again a larger model. What we are talking about, building state capability. So in the building state capability, one of the important pillars, like we have 5 pillars for building the state capability. One of the important pillars is building political supportability. It is so important that building that political supportability. As a part of building supportability, we have come up with this idea, and we are working closely with ISB, Bharti, Institute of Public Policy, where we are actually, in fact, getting the best of the best ideas to the legislators. We deliberate, we have these public policy workshops with the legislators, and we also have the exposure visits. So it's and also we have some fellows attached to the honorable members of Legislative Assembly, and who, also actually give the data, using the data, the conversation can happen in the assembly. So the idea is that there is everyone would see the larger vision for the people. It's again to really make the state a different state, and which is trying to do things differently, and
Definitely, it's been a pleasure for ISP to work with the government of Meghalaya. And, it's very important towards the end. What I feel is administrative initiatives are definitely important. But what is more important is the political will to make that change. And I think Meghalaya is an example there. So thanks a lot to you for sparing your time for the policy talks. And it's always a pleasure to be with you.
Thank you very much, Dr. Aarushi.